Well, currently the pause that's been implemented by the FDA and the CDC means that in the US, we will not be using this vaccine until the pause is lifted. The CDC is going to have a meeting tomorrow, and the FDA will be involved with this to discuss the current issue, what the numbers are, what the science behind it is, and to try to shed further light on where they should go from here. Right now, the numbers look like they are somewhere in the 1 in 1 million events. That is, for every million people vaccinated, there's been one of these, which are truly unusual types of clotting problems that are associated with a very low platelet count, and unfortunately can result in death. These are very rare events. It becomes very hard to assess then the risk-benefit to a particular individual patient. Now, right now, this seems to be more common, or almost exclusively, in people under age 50. It's a very rare event. I wouldn't lose any sleep over it. I would pay attention to symptoms, though, and not ignore them should you have them. And I think that the rarity is something that I think should give most people reasonable reassurance that they'll be okay. The symptoms that the patients who presented with these unusual blood clots have been primarily headache that is really unremitting and more severe than a usual headache. The other is abdominal pain, has also been associated with clotting in the abdominal veins that have also been associated with this very rare event. And so the CDC's recommendation then is that anyone who has received the Johnson & Johnson vaccine to pay attention to symptoms such as that. One of the things, though, that's helpful is that these events have all seemed to occur in that very close proximity to recently been vaccinated, and that individuals, for instance, who were vaccinated several months ago, would appear have no risk. It is a difficult situation where you have risk-benefit. Clearly, the risk of dying from COVID far exceeds the risk of dying, say, from one of these very rare 1 in a million events. One thing is very clear. Either of two things are going to happen as an individual. You are going to become infected with coronavirus. This is a given. No one will avoid it. Your alternative is to be vaccinated to either avoid infection completely or to avoid serious outcome. And this is a decision that each individual needs to make. I mean, this virus is here to stay. It's not going to disappear. It will infect everyone eventually. And it may well infect everyone eventually who's even been immunized, except that they will not have risk of death or pneumonia or hospitalization. Anytime a new vaccine is developed, the clinical trials are done in rather select populations. That is, it's not always everyone. It's select groups of individuals. And the studies, although large, if you consider 30 to 45,000 or 50,000 people large, are not large enough to identify very small risk events, such as 1 in a million. I mean, we would have to do a study with multiple millions of individuals which is never done for any approved vaccine or therapeutic. And so once these drugs or vaccines are rolled out to many, many millions of people, it's why it's so critical. And the FDA does a very good job at this, and the CDC does, of keeping track of these rare events. And it's not uncommon to be in this position. This is something that clearly has happened before, and will undoubtedly happen as we have new medications as they come out.